We're going to go ahead and get started.
Yeah.
Hopefully some more people will filter in as we go. I'm going to start with introducing our panel. Our panel is made up of three University of Michigan faculty, all of whom are editors of journals. We'll start with Matt Boulton, who is an M.P.H. He's a professor in epidemiology, preventive medicine, and health management and policy at the School of Public Health. He's also a professor of internal medicine and infectious disease division at the health system. And he is a senior associate dean of global public health at the School of Public Health. He's currently the editor-in-chief of the American Journal of Preventive Medicine. He's also director of CDC-funded Center of Excellence in Public Health Workforce Studies, the director of Preventive Medicine Residency here at the University of Michigan, and associate director of the HRSA-funded Behavioral Health Workforce Research Center. Our second editor is Preeti Malani, who is a professor of medicine in the Division of Infectious Diseases at the University of Michigan, and she is the associate editor of JAMA. You may have heard of that one. She received her MD from Wayne State University, and prior to medical school, she completed her master's in journalism at Northwestern University's Meadows School of Journalism. And then our third editor is Ann Sales, who is a Ph.D. and RN. She is a professor in the Department of Learning Health Sciences at the School of Medicine. She's also a research scientist at the Center for Clinical Management Research at the VA. Her training is in sociology, health economics, econometrics, and general health services research. Her current work involves theory-based design of implementation interventions, including understanding how feedback reports affect provider behavior and through behavior change have an impact on patient outcomes, and the role of social networks in uptake of knowledge and translation interventions. She is co-editor-in-chief of Implementation Science, together with Michael Wensing in Heidelberg University in Germany. So those are our three panelists, all editors, all faculty at the University of Michigan. We hope to make this somewhat interactive. So we are going to ask each editor to respond to a question one at a time, and between responses, we're going to allow the audience to ask questions. So please feel free to ask questions as we get through it. And the first question we're going to ask is just to give general impressions from each of the editors about the important changes that have been taking place recently in both the peer review process and publishing over the last couple of years. So I'm going to start with Matt, and go ahead.
Okay. Yeah, I'm at, yes. So I'm going to mention something that I didn't mention in my email to you, which is globalization. 5 years ago, less than 5% of the submissions to the American Journal of Preventive Medicine were from international authors, and now that's about 35%. So it comprises a significant proportion of the papers that we're receiving. And the big increases that we have seen have been from low and middle income countries, most especially China. So that holds out the promise of significantly altering both the composition of papers that we publish in the journal. In fact, in the last year, we've started a new section called Global Health Promotion and Prevention, specifically for papers from authors in low and middle income countries, but also the content, so that we're likely to be looking more and perhaps giving preferential treatment to papers that take more of a global perspective. I mean, we remain the American Journal of Preventive Medicine, so we're very domestically focused, but clearly that has a lot of implications for our future. And also, we're also now starting to enlist reviewers from other countries because we are receiving so many papers from international authors. So it's affecting not only our review process and the composition of papers, but also the funding and marketing of the journal. We're an Elsevier journal, and they're making significant outreach, especially to China and India, because the market there is almost limitless. And there appears to be a significant desire, especially in China, to publish in English language journals. So I think that has potential for really dramatically impacting how we publish and how we're funded in the future. One other issue I wanted to mention is that, and I mentioned in my email, is that one of the things we're dealing with right now in peer-reviewed publication is duplicate publication of scientific manuscripts. And so the best example, I think, is the Centers for Disease Control's Morbidity and Mortality Weekly Report, and I actually served and have served for quite a while on their editorial board. Increasingly, other journals are picking up and reprinting what's previously published material from the MMWR. So if you look, there are about 7 journals, JAMA amongst them, who's actually reprinted MMWRs for over 15 years. They were the first to do it. And other journals are now doing it: New England Journal of Medicine, Annals of Internal Medicine, Pediatrics, American Journal of Public Health. And interestingly, those appear as dual citations, so that an author can cite that either as a New England Journal of Medicine article or as an MMWR, but yet it represents reprinted material. And I think right now we're struggling with how to treat those papers because they contribute to the metrics for the journal, so they're part of the impact factor, for example. And that also occurs when you jointly publish with another journal. So just in the last year, my journal has co-published an article on immunizations and international vaccines with the journal Vaccine, and so that appears both as a citation in Vaccine and as a citation in the American Journal of Preventive Medicine. So there remain a number of issues that we need to address, and we need to reconcile, how we're going to treat these, both with respect to the journal and respect to the authorship.
Great. So we'll take any questions about those two topics.
A question about the globalization and the papers coming from China.
The papers coming from China and India, what steps can you take to sort of verify the accuracy and quality of the papers? Do they typically have authors, co-authors from countries who've published in your journal previously, or are these sort of new submissions that it's difficult to judge sort of the standards that go with them?
Yeah, I'd say that they're trending towards a lot more now towards all Chinese authors, for example. I think one thing that's helpful is that many of these are coming from institutions like the National Centers for Disease Control, where our own CDC has a large presence, and that would be true of the large provincial CDCs, or like the Tianjin, Shanghai, Chengdu CDCs, and so oftentimes you will see an American author. But absent that, I think it's helpful, in fact, that that they do come out of these leading institutions and/or leading academic institutions like Beijing University or Fudan University. But that remains, that remains a challenge in terms of the rigor with which, for example, one of the issues we've had is informed consent. So we receive these papers, and there's 4,000 people in the study. It's an RCT, and there's a 100% participation rate. So every single person who was approached participated, and no one dropped out over a 4-year RCT. So, obviously there might be issues there that, remain to be resolved. I will say that the majority of those papers continue to fall out over, the quality of the paper. So there's a lot of services now that are being made available to authors, especially in China, to assist them in adapting their papers to a Western audience. So there's a whole business that's sprung up, around that.
Just one follow-up question. How do you handle the review process? Are you identifying sort of reviewers from China and India who know the local research environment, or using some of your typical reviewers?
Yes, we are. And in fact, what we've started is we've brought those individuals like Srinath Reddy, who's president of the Public Health Foundation of India and a very well-known international, he's kind of a luminary in international public health. He's on our editorial board. So for example, he's been tremendously helpful with identifying reviewers in India. We're using a like process in China and other countries.
Any other questions before we go on? All right, Preeti, you want to?
Sure. So in terms of changes over the last few years, I'd say at JAMA there have been 2 really big things that are pretty universal. One is the digital footprint, and I'll talk a little bit about that. Really, these days, how many of you look at paper journals? Probably not many of you, sort of look at things on devices and sort of mobile phones and online. So that's been a big change. And the other thing has been the formation of the JAMA network. And when our editor-in-chief, Howard Bachner, who was actually here last week, when he came on in 2011, one of his missions was to create the JAMA network. So this is the former archives journals. There were 9 of them. They were called Archives of whatever, and they all changed their name in 2013. And it was more than a name change. It was really a culture change. It was really like a family of journals. In addition to the 9 former archives journals and JAMA, there were 2 additional family members that were brought on new, JAMA Oncology last year and JAMA Cardiology this year. And I think from the standpoint of authors and readers and reviewers, it is really different. And there's a process called cascading, so you can submit your paper to one journal, it can be transferred, it can be looked at, it might end up in a different journal. And there's also reverse activity. A really great paper in JAMA Cardiology will put that abstract into JAMA. And things that have sort of more broad appeal. Same thing with editorials. There's something called From the JAMA Network. And so your paper that was in JAMA Pediatrics may get a separate editorial in JAMA. So I think that there's a lot of interplay and synergy there. So that's one thing. And then the digital piece has really been interesting. And this is a place that I think JAMA was really lagging when Howard got there. And actually, I have a few numbers that I brought to just give you a sense in terms of digital data. And we think a lot about that traffic to the website. What does that mean? And so in 2011, I think there were about 13 million visits. It's now up to 22 million. In terms of PDF downloads, from like 2 million to 6 million, HTML 4 million, 4.6 to 26 million. And in terms of sort of mobile devices, just from 500,000 to 6.8 million. So you're talking, they talk about this moonshot number a lot, about 100 million across the network, and it's amazing. We'll probably be at 68 million this year. And some of that was because like the Obama paper got 1 million views, so that takes you a long way along it. But it's more than that. It's sort of this ecosystem of products. It's not just sort of reading JAMA online. It's looking at the reader, then using those materials to distribute them to the media, and developing CME products around this. So I think that that's been a really big change, and just the activity around that has been incredible to see.
Great, thank you. Let's take a break for some questions. Anyone have any questions?
I was wondering if you could embellish a little bit more on the alt metric that has been developed by JAMA, and whether you think that will either supplant or continue to elaborate for other journals that are not just looking at impact factor anymore.
Yeah, great. So this is alt metric. Actually, alt metric was not designed by JAMA, but it's been an important metric, and it's one that's been very prominent on our website for a couple of years. And this is it's like a real-time measure of impact. It's driven mostly by media pickup, also views, social media. It's something that citations can take months and years, but alt metric gives you a sense of immediate impact. And it is, in terms of the algorithm, no one's quite sure of it, but it is really driven by media coverage more than anything. I think in a lot of journals, the number might be single digits for papers. Some of the things that, a good editorial might still be like below 100, and then something that's, actually our highest alt metric ever was the Barack Obama ACA paper, and it was like 7,500. I mean, I think it may be the highest ever for anything. I'm pretty sure, and it was 3-fold higher than our previous record, which was still like off the charts. So it's really interesting, and we pay a lot of attention to alt-metric scores, and we're trying to use them as a sort of a feedback device, if you will, to authors, and sort of letting them know what this means. And I think that it's something that in the last year, I've heard a lot of it from my colleagues, like people are paying attention. I think eventually promotion committees may start paying attention too. I'm not sure if we're quite there. But the alt metric, take a look, and a lot of journals have it. It's usually on the right, depending on how high it is, it has more colors. So.
Great. One more question, anybody else? Okay. Go ahead. Yeah.
Well, I think implementation science is probably the smallest and most niche of the 3 journals represented up here, and I think also probably the most recently launched. This is our 10th year of publication. And we've grown from 75 submissions in the first year in 2006 to we're probably going to hit 800 this year, which for a journal our size is a big deal. We're talking orders of magnitude difference here to some extent. But I wanted to reflect a little about peer review. We actually have completely open peer review, which is not that common in publishing industry yet. And it's not that common in health publishing in particular. And so what I mean by that is that we have both the reviewer knows who the authors are and the authors know who the reviewers are. Now, it is the case that authors have to dig a little bit more than they used to have to figure out who the reviewers are, because they have to actually go on the website and take a look. But the information is there and accessible. And while I personally think that that's the right thing to do, and I think, I would like to think that we're moving in a direction where we're moving towards open review across the board in not just peer review in manuscripts, but also peer review proposals and other things that get peer reviewed. I have to say that the tide is pretty strongly against this at the moment, that there's a lot of pushback. In fact, we got a comment from one of our senior reviewers, someone on our editorial board who did a review for us, which he said, it made me really uncomfortable that the people who are going to read my review know who I am. And I thought, wow, if this person is worried about that, then obviously junior people are going to be way more worried about that. And it disturbs me a great deal on a number of levels, but it particularly disturbs me that we really don't have a culture in health research that leads to openness and leads to the ability for people to just say, I know how I will express myself. I'll also say we've had some reviewers not realizing that we had open review and that their names would be attached to the reviews, who come to us kind of panic-stricken after the fact and said, please, can I change my review before it goes up? Because what they wrote was, a little harsh, not necessarily totally professional, and it's become clear to me that the sort of the veil of not knowing in an official way who a reviewer is has changed behavior, not always for the better. So personally, I think open review is a process that we should be striving for, but I'm not sure it's going to happen soon. I'll also just say, and this may be related to having a policy of open review, we have a very difficult time getting reviewers. And I was reflecting on that this morning and thinking, yeah, some of it is people look at the open review policy and say, well, if they're going to know who I am, I don't really even want to do this review because I don't want to have to deal with the ramifications of perhaps saying something negative that senior authors may not like very much. But I think the bigger issue is not that. I think the bigger issue is that in the busyness of today's world, reviewing manuscripts is not a high priority. And yet, it is, when Preeti used the term ecosystem, it is incredibly important in the ecosystem in which we exist. Our universities rely on peer review processes for making funding decisions, which then make promotion decisions, making decisions about publication, which also feed into promotion decisions and other things. And when people decline to review, which we find happens a lot, then they're opting out of this process, and their voice isn't going to get heard. But part of the issue, and one of the things I'd be interested in discussion with all of you about is, are there ways to make this more rewarding for people? I mean, you get almost nothing out of doing a review. And I'll say, I actually am sitting on ACAP now in the medical school, and I've been on P&T review committees for many years now. And I'll be honest, I gloss over that section of everyone's CV that says what reviews they did. Although if it's absent, that's definitely not a good signal. That suggests to me that this is someone who's not providing any service to the broader community. But in general, most people have this list of reviews that publications for which they've reviewed, and yet they get very little credit for that. It's just sort of the check mark. So I think there's a real breakdown in terms of rewards and perceived benefits against the cost and time required to do reviewing. And I think it's a serious problem for all of us, because if it's only a few people who do reviews, then those people have disproportionate weight. And I think that that is a serious issue.
So, Anne, I'll sort of reflect on that, but also ask a question. Clearly, there's issue with review, and there's issue with volume of review. I mean, I probably get a request every week from journals usually I've never heard of. But there's also the lack of training in how to do a review. And it really strikes me that we're asked to do reviews all the time, but never really given feedback on how helpful our review was, other than just the summary that went to the author, and never taught how to do a review unless we had a mentor up front that provided that. And so, especially as a journal that doesn't have quite the name recognition or impact that, say, JAMA does, how do you address those issues? Is there an opportunity to use education and feedback to then build in a little bit more incentive for your reviewers?
Yeah, I think that's a really good point. And we have discussed that many, many times. The problem is time and energy. And this is an issue I think we'll probably get to more in the next question as we discuss issues in the world of publishing and the sort of business side of publishing. But the reality is that almost all journals, with few exceptions, JAMA being one, really run on volunteers. There is very, very little payment involved in anything associated with publication in research. And so everybody is doing this completely off the side of their desk. That's not an excuse, and I think your point is a really good one. I think that journals like ours have an incentive and should be doing a lot more, offering opportunities for training. And I think we could. And, I think it would involve reaching out to our editorial board and enlisting them as mentors, and then getting them involved with trying to recruit trainees, junior colleagues to work with them. There are small issues around confidentiality, but again, with an open review process, it's much less of an issue. But those are actually really small. I think the bigger issues are time and energy issues.
So the Annals of Family Medicine has an editorial fellowship for junior faculty. Have you guys done anything like that? Not any fellowships?
Yeah, as you know, Carolyn, we run a fellowship, so we have residents who are in the preventive medicine residency, and that's just been for U of M residents, but now we're opening that up nationally so that we will be able to take up to a couple residents in the fellowship, and these are individuals who have a specific interest. Beyond that, a couple of things that we do, because reviewers are very difficult. We have a database of about 15,000 reviewers for IHPI that we rely upon. We score those in a quartile system in terms of what we're looking for, and we provide instructions to the reviewers in terms of what are the elements that constitute a good review, although I think a lot of reviewers don't look at that, so consequently you get wildly variable review quality. But we also recognize then our top reviewers of the year. We recognize everybody who reviews for us, and then depending on how we scored them, we go through and we'll recognize them and give them an online certificate, which seems to be well received, but it takes a lot of effort to encourage, and I give quite a few talks on at the college and in other venues about reviewing and what constitutes a review, what is it that we look for in a good review of the journal.
I would just add that I think a lot of the more niche journals, society journals, I think there's fatigue, reviewer fatigue. But I've seen that done where you get like sort of the top 10%, and I think that's, people, they do like to get that. And I think the ones who don't do a very good job over time, you don't, because you have a scoring system, they don't get asked. I'm always trying to bring in new people to review, and I think it is probably a little easier for me to get reviewers. One thing that I think is important to recognize as an author is that journals, like, their job isn't to kind of give you a review so that you can use that information for your next submission. I mean, it's just like you can't, that pressure that you talked about, in terms of the ecosystem too of academics, like the number of papers that are being published and being submitted is just astronomical, and there are not that many more faculty and experts out there. So, one of the things I'm very careful about is whether something really should be reviewed or not. know, sometimes someone has reached out and asked someone else, you know, can I submit this? And if someone has, quote, encouraged submission, it's hard for me to turn around and reject it, even though I know, like, this isn't going to make it. But otherwise, I have a pretty high bar on sending something for review, because it's just going to hold things up for 6 weeks. It's not going to be helpful. It's not really fair to the reviewers. One thing, too, is if you do good reviews and the journal is looking for an editorialist, often one of the reviewers is asked. So I think that is an incentive for folks. That it's one nice little carrot, I guess.
Yeah, and I don't think I have anything really to add to that, except to say, I think there is also a role for the institutions to start to actually pay attention. And I'm saying, as an individual member of a P&T committee, I'm not doing that yet. It's going to take a while. It's a pretty uphill climb, but I think this is an area where, as faculty, we can actually start to put some pressure on the universities to say, recognize this when you get a certificate for an outstanding review. That should count for something, as opposed to just being one more piece of paper in your package.
Great.
And I had two questions. The first is, do you see any effect of the type of groups like Boulton or others that are trying to keep track of peer review history of the peer reviewers? Any positive effect on the interest of the peer reviewers by these things like Boulton? Do you see any of them? That's the first question. So no one has.
No, I mean, I get those requests in my inbox, and to be honest, I've clicked through once on the link and said, too much work. And just, but it's having no effect at all on reviewers that I can see.
And then the second question is there any big effect of author's name for publications in JAMA? For example, if I think I have found something interesting, but it's years behind that I have that name. So if a junior faculty sends a paper with a junior faculty as a corresponding author, is there a negative effect other than the merit or the substantial aspect of the paper? So what is the effect of a name of a junior faculty on the paper when it is being submitted to JAMA?
So I think it's a great question. I mean, at JAMA it is single blind, and you know, I think it's part of the consideration. But I want to point to a paper that was published in the last couple weeks in JAMA as a research letter. I think it's just a fantastic paper, because it was a randomized control trial. It was an orthopedic surgery group, and they did a paper. It was a sham paper that they created, and it's just fascinating in terms of just a research methodology standpoint. And they put the names of a couple famous orthopedic surgeons on it, and they had it reviewed single blind and double blind. And from talking to my friends in orthopedics, a lot of surgical specialties, and I think nursing also, they do double blind reviews more than we do in internal medicine. And there was a big difference in terms of who said to accept versus reject. It was within the last couple of weeks. So, you know, to me that it generates pretty interesting data there. You know, that there probably is a difference, but the question is that difference there because, you know, there's obviously selection bias. You know, people who are well known and they're established investigators. Well, they're established investigators. We treat the papers with the equal amount of rigor. I don't think we let anyone sort of slide on anything. But, you know, you certainly know, like, someone who is a very good investigator, they're sending you a randomized control trial that is truly potentially practice-changing and novel. I mean, that's a paper that you definitely want to see. But I think that issue of, you know, sort of that bias that you might have, good or bad, and like you mentioned, you know, junior faculty being sort of corresponding authors, you know, just it sort of depends. I mean, it's good for them to be corresponding authors. If they're the ones who know the information better than anyone, they should be the corresponding author. But if it's just sort of like to put them there and they don't actually know it, then it's probably not appropriate.
Yeah, I was going to say, we also work in a single blind review process. It doesn't extend just to the authors, but also to the institutions. I mean, something that we do track are the institutions that are submitting to us and how frequently we're publishing from those institutions, because there's been quite a bit written on institutional bias, that is, certain institutions are favored over others in terms of the likelihood of faculty there being published. But, I mean, peer review has lots of issues. It's a flawed process, but it's the best process we have, and I think clearly reviewers are impacted by that, by the names, and that's one of the cases you can make for a double-blind process, in which the reviewers are not seeing the author's names. I think that's one of the more powerful arguments that could be made for that. But I think by and large, a lot of the medical and scientific journals continue to work in a single-blind process. I think that's probably the most common review construct that the journals have.
So just to clarify, the single review, double review thing. Implementation science is a non-blinded process. Open reviewers' names, open author names during the review process. JAMA is a single blind, meaning the reviewers don't know who the authors don't know who the reviewers are. Right. And AJPM is single blind. And there are some journals that still try to do the double blind, where they remove the authors' names. It turns out it's actually pretty easy to tell who the authors probably are by looking at the set of references that they cite and where it says our work showed, and then but they tried to do it a little bit more blinded. So at most journals, I think, are currently single blind.
Yeah, I received a paper the other day with a review, and one of the reviewers, and he listed 11 of his papers that the authors needed to cite, which would then make that a strong paper.
Right. Right. Sometimes you can tell the reviewers by what they want you to cite.
Yeah, for sure.
That's true too. So that it makes me. Let me just say one more thing here. It makes me think of a review that we got at AJPM once that said, this paper would not have passed a master's level midterm paper. And you couldn't really write that in an open review process, but it actually told us a lot about the paper. And so when you switch to a fully open review process, I think you may lose some of the sort of the depth of the seriousness of how bad a paper might be, or how good a paper might be, by making people a little more careful with their words. What do you think about that?
Well, I guess I would really, I hear you, but I think we all need to have a little more courage, frankly. I mean, I think that's a kind of a harsh thing to say, and I suspect the reviewer, like I said, was sort of hiding behind that veil of blindedness. But actually, this senior reviewer that I was talking about said something very much like that in his review, and that's what made him really uncomfortable. But it was honest, and it was real, and it was not uncivil. I think there's a borderline between incivility and just insulting people in a way that's not necessarily not useful, and saying very honestly, this is really not a particularly good piece of work, and then here's why. That I think is
so one of the lessons for reviewers is, even if it's single-blinded or double-blinded review, you never know when your review is going to get exposed somehow, just like the Clinton emails, etc. Be careful what you write in a review. Make sure it's honest and civil. That's one take-home message from today. We had a question.
Thank you. So you talked a bit about the difficulty in finding reviewers, and I don't know if any of your journals do this, but I've noticed more and more when I submit a paper as an author, I'm asked to suggest reviewers for the paper. And so my question is, how commonly are you actually asking those people that I'm suggesting, and then do you have any recommendations for who I should be suggesting?
So let me just say that actually, we used to have a place on the website where people would actually list potential reviewers. That got taken down because of some fraud issues that were systemic and widespread, where people were actually creating false email addresses, and those review requests were going to them or their colleagues. So there are publishers now who don't try to encourage suggested reviewers. We now suggest that people put them in their cover letter. And the answer is, if somebody suggests a reviewer to us, We'll always look to see whether they're closely aligned, like they've published with that group recently, and if they have, we won't invite them. But if they haven't, then we typically will invite 3 reviewers, and I mean, personally, I would always invite one of the people who was suggested by the authors, one person that I know is probably going to be able to do a good review, and then try to pick someone who seems as though they would do a good review, but I don't necessarily know them, to try and get a diversity of viewpoints. But I think it is helpful to suggest reviewers, but just recognize that there is actually a bit of an issue around that at this point.
Yep. 2 brief comments on that. One is not so much that I'm going to necessarily go with the reviewers you suggest, but if you tell me that someone shouldn't review,
yes,
I think most editors would honor that. Like if someone says, gee, because there's like hundreds of other people you could use. So if there really is someone that you feel can't be fair or is unfair or is a competitor or for whatever reason, I think it's fair to let people know. And I don't think that gets counted against you in any way. The other, what else was I going to say? I lost my train of thought.
Yeah, I would say it's hard to overestimate how much time journals spend in terms of vetting potential reviewers. That's actually a huge amount of energy is expended around that. We also prefer that any suggestions for reviewers are made in the cover letter, but then we do expend effort trying to validate who those individuals are and add it to our database. I mean, I think our greatest source of new reviewers tend to be individuals who are newly publishing in the journal. We typically will enlist them as new reviewers, but a lot of that has to do with the topical concentrations that we're looking at in terms of how the papers or the composition of papers that we receive and are being submitted by the journal. For example, AJPM has been publishing for 25 years in obesity research, and so we have a huge number of reviewers in that area. Conversely, we're doing a bit in implementation science. We have a lot fewer reviewers, so that makes a difference in terms of how, what kind of effort we'll expend looking for new reviewers in newer topical concentrations.
I remember what I was going to say, which is, so the peer review congress, which is run by JAMA every couple of years, there is a little bit of science behind this. There's not much, but what I've been told by the folks who run that is that there's not a difference between suggested and editor-picked reviews overall.
Okay. We'll go on to our next question, which was about the financial stability of journals. And in a world where there's a lot of competition now with online things like The Conversation and a lot of social media stuff going on, and a lot of open access pay-to-publish journals out there, how are some of these top academic journals surviving? What's your total budget? Where does most of the money come from? What are you doing to look forward and keep yourself financially solvent? And what do those pressures, what kind of effect do those pressures have on what you publish? You want to start?
Sure. So I should say that we are an open access journal, and we're entirely online. We have no print version. Partly that's because we're only 10 years old. And in fact, authors do have to pay to publish in implementation science. That's because there is no subscription fee, so once it's published, it's open access, it's out there for people to get. But I think there's confusion around, there are many different models out there in terms of online open access journals. And there's a lot of confusion around legitimacy of those journals and what is and is not legitimate. So I'll just say there are lots of predatory journals, and typically those are the ones we get, like 3 emails a day from at this point. And they're not that hard to figure out. There is something called Beale's List, which lists predatory journals, and if you get a request to submit a paper, a solicitation to submit a paper to a journal, I would always check Beale's List before you even entertain the thought any further. So I would say, the other thing I would say is we do not have any society behind us. We are actually a purely independent journal, which is a complex and interesting place to be. And every time we have face-to-face meetings, which is once every 2 years, we talk about whether or not we should try to find the society to affiliate with, one or more societies to affiliate with, whether we should try to launch a society, whether we want to continue to be independent. And so far, we continue to feel that being independent is our best bet. However, being independent doesn't mean we self-publish. We definitely don't do that. That's a whole nother step beyond. And so I did want to talk a little bit about the publishing industry, because in essence, right now, with the not including JAMA, New England Journal, Lancet, and the M.J group, there are really three major publishers in health, and those are Elsevier, Springer, and Wolters Kluwer. And the reality is that, so they're an oligopoly. I mean, let's just call it what it is. They control most of the outlets, and they have differing business models, sometimes within their own organizations. So the publisher we started with, Biomed Central, which was based in London, got acquired by Springer the year after Implementation Science launched. And there are days when I wake up and think, I wish that the founding editors-in-chief had actually just withdrawn from that journal as soon as that acquisition happened. Not really, those are only a few days out of the year. But there's a reality that, you know, what the publishers need and what they do is very different from the academic mission of publishing a research journal. And they have very, very good people on their publishing staff who become quite expert in the domain areas in which they handle publications. But their purpose is to make profit. And I think we just have to really be honest about that. And their profit models are very complex models at this point, because how you make profit off of an open access online journal is not a trivial thing. It is really all in the article processing charge. And we have ongoing discussions with our publisher about that article processing charge, which we think is pretty high. It's not as high as some other journals charge for open access publication, but it's higher than others.
What is it? Tell them what it is.
Well, for a University of Michigan author, in US dollars, it's $2,000 per article. The actual publication cost, if you don't have the 15% discount that being a supporting member, a part of a supporting member institution, is more like $2,600 or $2,800, somewhere in that ballpark. So that's not insubstantial, and it's not something most people are willing to pay out of pocket. So it does require that you have to have funding from some source that will actually support that. And that's not a trivial issue at all. So, but contrast that to the subscription service approach. And Springer also has plenty of subscription service journals as well. That's where libraries typically, because they're the largest group of subscribers, are paying literally millions of dollars a year for subscriptions. So there is no free lunch. I think that's a really important reality to understand. And you know, someone is going to pay somehow for the work that has to go into producing, you know, the pieces of paper that we value and that we want our work to look at, as well as what we want and expect to read.
Did you want to share questions? Or?
Yeah, so we're both a professionally sponsored journal. So our two organizations are the American College of Preventive Medicine, which is the specialty college for physicians who are board certified in public health and preventive medicine or occupational medicine, and also the Association of Prevention, Teaching, and Research. So receipt of the journal is a member benefit. Our publisher is Elsevier, so we're an Elsevier, part of the Elsevier family, huge family of journals. Man is right in terms of how the market's dominated by relatively few publishers. One of the advantages, of course, is that it's very difficult, or can be difficult as an independent journal, to get the adequate attention from acquisition librarians or others who have purchasing decision-making authority at institutions like University of Michigan. If you're out there on your own, and being part of a portfolio of journals that oftentimes publishers like Elsevier will package together, 20 or 30 and give a significant discount for paying for all 30 of those journals. Likewise, there's tremendous fiscal efficiencies for journals because they provide sales and marketing and also technology support for the journals, including things like social media. So those are tremendously helpful, but you're also beholden to those publishers. It's rather a black box in terms of what their profit margin is for the journal. They're in business, and so when they tell you that, oh, we publish you because we really like your journal, I suspect they might like us, but they also like the profit margin that they realize through the journal. It is a very difficult and challenging environment right now fiscally for journals. I was saying in one of my emails that I recently attended the Council of Science Editors, which is one of the main annual meetings for individuals who are working in medical and scientific editing, and they had a 2-day workshop, and so there was a lot of discussion. There was about 40 editors-in-chief there, and it was just replete with examples of failed journals. In fact, a lot of the editors-in-chief had been part of a failed journal previously, so it's very challenging to make these meet. We don't draw down very much advertising, which is a fiscal disadvantage for us. So it's part of the member benefit. We're reliant in part on supplements, so we have a robust supplement program. In fact, as an associate editor of the journal, Carolyn's involved in reviewing a lot of the supplement submissions, and those can be all over the place. In general, I'd say that the quality of those articles is not as good as what we publish in our regular monthly issue, although they can be good. We just released a national CDC sponsor and CDC is our primary sponsor for our supplement program. We just released one today using National Violent Death Reporting System data, looking at the lethal encounters with law enforcement and also death of law enforcement officers in line of duty, and those are drawing down huge attention. But I don't like the fact that we're reliant on that as part of our fiscal model. We have to publish supplements to survive. We wouldn't be able to do it, and we're in pretty good fiscal shape right now, but again, that our fortunes are very much tied to our supplements. So it puts you in a challenging position when you're given $80,000 to purchase a supplement, and then you get all these papers for the supplement, and some of them are not very good. And you've got to figure out how to nuance that in terms of what qualifies to be published and what does not. And I actually think handling supplements, which Carolyn does and I mostly do not, is actually a more difficult job than handling submissions to the regular monthly issue. The only other thing I would say is that with regard to globalization, you're having to interact with multiple platforms. Readers are expecting 24-hour functionality. You have different systems, different operating systems, different bugs you have to deal with, and that part of it's become a lot more complex in terms of the technological support that's required when you have a journal, even that's domestic, in order to avail it, to utilize those different types of technology supports, both domestically and internationally.
I don't have as much to say. I mean, JAMA is different. It's very well resourced. I think pretty much every library does subscribe, and I think that is really where a large bulk of the revenue comes in, ad revenue. I suppose membership also. It's a complicated relationship with the AMA. It is the Journal of the American Medical Association, but there's an editorial division, it's complete editorial independence. And we take up a whole floor of a big, the old IBM building in Chicago. There are 186 people, I think I said that earlier, about half in publishing, half in editorial, and then there are another maybe 20 associate editors scattered around the country, so it's 200 people. And then that doesn't include all the JAMA network journals. So it's like a very different situation, but in terms of being aware fiscally and sort of managing your resources and being able to create new content and new new plans and new initiatives, there's a lot of focus on it. One thing we don't have is open access at JAMA. but we make certain things free because it just makes sense to do so. And our publisher, Tom Easley, is really great about that, about supporting that. Some authors really want that, and that might be something that we'll think about because we want to get a certain paper published with us. You know, it's changing, and I think open access is something with the newer journals, with oncology and cardiology. They have a hybrid model. It's sort of an experiment to see what happens. And about 10% of papers in oncology are open access, and it's been across the board. It's been from, it isn't all pharma. It's everything from Gates to CDC and others. But I think some authors really want that. And so I think we're thinking a little bit about how we can offer that, but still kind of keep it within certain use categories.
Could I add one more thing? Yeah, I failed to mention that, so we're still a print journal, and that comprises about 2,500 of our subscriptions are print, but the overwhelming majority are digital. Individuals, so we don't charge anything for submitting or publishing in the journal, but if you want to pay, you have to pay an open access charge if you would like it to be open access. Because we've seen a tremendous increase in the number of submissions to the journal over the course of the last 5 years, part of that international, we're down to publishing less than 15% of all submitted papers. So we're in the throes of deciding whether we want to start a spin-off, online-only, open access journal, which Elsevier is very much in favor of, because I think they perceive this as a potential revenue stream. And I think there are potential advantages and disadvantages associated with doing that, but we're in a place now where we've begun conversations. Of course, Carolyn, you've been part of those conversations.
Yeah, so some of the funders are also starting to encourage budgets in grants to include payment for open access publication, and PCORI has a separate fund. When you get a PCORI grant, if you write a paper and you want to publish it in an open access journal, you can apply to this separate fund and say, hey, you funded my grant, I got the results, I'd like to publish it open access, can you pay for that? And they will. So things are changing pretty rapidly. I have one more thing, we only have 2 minutes. Oh,
I just want to add to that. M.P.H requires that you must submit your manuscripts to PubMed Central. And I think that most journals will allow you to do it. They've developed mechanisms and policies to allow that. But the reality is it puts a lot of burden on individuals, whereas journals that are set up to be open access do that routinely. That's just part of the process. And I think this kind of morphs into your next question, if you have time for it, which is open science, which is more than just open access on publications, I think is the wave of the future. So I'll stop there.
So we only have 2 minutes, but I'll just throw it out there. We'll get 1 or 2 comments. There's a strong push in the publishing industry right now not to publish papers unless you also publish the raw data in an archive or open access. And I would say it hasn't really reached our community of health services researchers yet, but it's quite active and already a journal policy for a lot of basic science journals. So you must post your raw data for other people to analyze or reanalyze to show that you actually have the data that supports your conclusions in your paper. And this has been discussed at editorial meetings and conferences, and many journals have signed on to the principle. From a health services research perspective, it's a little bit odd. We pay lots of money to Optum and other places to get big data sets. Are we going to publish those data sets? So there's just a lot of issues around what we can and can't do with our data as health services researchers. But there are huge questions about where does the data get archived? Who has access to it that we haven't answered? And I was wondering if any of you have had to deal with this yet.
I can just comment very generally. It's something that we discussed quite a bit at the editorial board, and it's not going to go away. I think we're going to hear more and more, and I think the advantages are pretty clear, but there are a lot of disadvantages: inappropriate data use, sort of scrutiny that authors, researchers don't need, sort of scooping you on certain research. So I think figuring out exactly that balance is not easy, but I think that we will see this, and we'll probably see it soon. And what it'll look like, I'm not sure.
Well, I'll just say we are seeing it. I know people have submitted to PLOS Medicine, and that's one of the journals that does require it. It says they require it anyway. But the issues of what, where, when, how are completely unresolved as far as I can tell.
Yeah, this just came up very recently with Elsevier. So Elsevier is actually encouraging their family of journals to go in that direction, and they want to open that up as an option with our journal within the next 6 months. So I think it would be optional at this point. I know as a researcher myself, having worked in China quite a bit, that's actually prevented me from publishing in certain journals because I simply do not have the latitude to release data from the Chinese government. So I think for international researchers that poses special challenges. But I do see it as a direction we're going to move in.
Or for the VA, which I really can't imagine releasing that data ever.
They say they want us to do it. They haven't told us how, but they want us to do it.
All right, well, I'll believe it when I see it.
Right.
So those issues will be in the future. The University of Michigan has changed their informed consent document template to include a line that says that the data may be released and de-identified in an archive in the future for publication purposes.
Yeah. And I'll just say also Deep Blue, which has been a long-standing archive of various kinds of materials, is now an archive of data as well. So we have repositories here locally that could be used. And ICSPR has been for a long time a model of sorts for release of data after you've finished doing your analyses. So I think we have models to follow.
And then the issue of qualitative data and de-identifying qualitative data is another big concern. So all of those things you can think about on your walk outside when you go back to your office in the 80-degree weather and enjoy. Thank you.